Hey, Doc, so
Yes.
a commenter who watched the live Q&A session that you did last Wednesday heard you say that knee replacements aren't the only option. Their question was, if knee replacements aren't the only option when you have arthritis, why are so many people told that that's the only option?
Yeah, I mean, I think people are told that they quote unquote need a knee replacement after they've failed all conservative treatments that don't work anyway, because that's what the insurance companies dictate. So basically, if the insurance company reimburses for a knee replacement and they don't reimburse for other things that may work just as well, like regenerative medicine therapies, then that's what's going to get recommended. So a lot of doctors don't know any better, or they just know that gets reimbursed, and they're going to recommend that. Also, it kind of goes to our training, the way we're trained. We're basically, if knee replacement is reimbursed by insurance, that's what we're going to get trained on. So you get trained in the system where everybody's told, hey, if you have arthritis, you're eventually going to need a knee replacement. And that's, I think it's all dictated by what's reimbursed and what's not reimbursed. And there's plenty of studies that show that regenerative medicine techniques can work just as well, if not better, than knee replacements. Dr. Hernigo's classic study of 2021 is the example, I would say.
Gotcha. So insurance companies don't reimburse for maybe what's the best option, but they just reimburse for. I don't want to make any assumptions.
I think that's true sometimes. Yeah, absolutely.
Yeah.
And frankly, I don't think they know any better a lot of times.
Yeah, very true. They're not seeing the patient, right?
So yeah,
Yeah. Understood. Well, thanks.
you're welcome.